Good evening, Nashville, Middle Tennessee, Southern Kentucky. Those of you as far west as Jackson. Those of you as far east as McMinnville. Welcome to Pharmacist on Call with your host, Dr. Sean Pruitt. And if you're watching this show, I am your community pharmacist. So everyone, this is our April edition. I apologize. We had some scheduling conflicts between the producer and myself and spring break and children, so we weren't able to do a March show. So we're going to do two shows in April. We're going to do one tonight, and then the second one is going to be April the 18th. So we're not going to shortchange you. But this is your 1 hour forum. This is where you get to call in and ask those burning health questions that you haven't been able to get answers from your doctors or your pharmacists. Because let's face it, they're busy. But for 1 hour, I have the time to talk to you. So call in with your questions and your comments. We're going to do as we usually do. We're going to get into some shout outs and congratulations and what have you. Birthday shout out for this month for Miss Crystalline Hall. Wanted to say a happy belated birthday to her. Wanted to say a happy belated birthday also to Hollywood Hound, my fraternity brother, there, Mr. Chris Gardner, for those of you who know him by his alias. And lastly, my daughter, my youngest, Jamise Sean Pruitt. She will be turning 6 on April the 26th. So shout out there, Miss Jamise. I also wanted to congratulate my daughters. Both of them have been pretty active. My oldest, Shauna, she and her team, the South Haven Wildcats, participated in the One Up National Competitive Cheerleading Championships at Opryland this weekend, and she and her team won first place. In fact, they have finished the season perfect. They were undefeated the entire season. So kudos, Shauna Pruitt. Great job to you and your team and the coaches as well. I also want to congratulate Miss Jamise Pruitt. She participated in the Jabberwock, sponsored by the ladies of Delta Sigma Theta, Nashville Metropolitan Alumni Chapter. And this, I believe, was a week or 2 weeks ago, and Jamise won first place in the Princess Delta category. So congratulations, Miss Jamise, on being the Delta Princess there. I wanted to do some condolences here. Looks like, well, mainly we wanted to send a shout out to and condolences to those of you who are fans of Nipsey Hussle, an artist, an entrepreneur, a father, a son, who was murdered last week in Los Angeles, an entrepreneur, a agent of change in his community. So wanted to send a shout out for those of you who are hurting from that. Personally, I'd heard the name in passing, never listened to the music, and had no idea about the work that he was doing in his community. So sorry to see someone like that go so early. All right, so this is your 1 hour forum. You get to call in with those questions, but if you're not, then we will talk about some supplements. So it looks like we'll get into some supplements right now. The first one I wanted to talk about was beetroot juice. So I know a lot of you, because we live in the South and our food is oh so good, that we tend to develop hypertension and we tend to develop diabetes and high cholesterol. Well, this is our supplement to help you on your trek to decrease all of those numbers. So this is great for blood pressure, great for cholesterol, great for diabetes. And we kind of came up on it when I first opened. I had a number of truck drivers who would come to me and they would say, hey doc, I need something to lower my blood pressure so that I can pass the DOT physical to get my driver's card. And a number of these guys were still on medication, but they still weren't getting any results. So I started putting them on beetroot juice, just 1 cap right before the exam, and all of their blood pressures were normal. So we began selling a bunch of it, and then I had a couple of them come in and say, hey, I noticed that my blood sugar is going down too. Is this stuff supposed to do that? And lo and behold, after I dug deeper into the supplement, yes, it does help with lowering your blood sugar too. So it helps to heal your pancreas, stimulate your body to making its own insulin. And in terms of blood pressure, what it does is it is full of organic nitrates, but we're going to get to that a little later. We've got our first caller here. Joanne, welcome to Pharmacist on Call. How may we help you?
Oh yes, this is Joanne. I'm calling for my husband James.
Yes, ma'am.
And he has leg cramps and then also tingling in his feet.
Okay. Okay. Is James a diabetic?
No,
he is not. Okay. Has he had back injury?
No back injury.
Okay. Well, that makes me think then we're ruling all those out with the cramps. probably his potassium is low. Is he a construction guy or a heavy labor guy?
No, sir.
Okay.
And he is on potassium pills.
Okay, and I guess he's on blood pressure fluid pills too?
Blood pressure fluid pills.
Like a hydrochlorothiazide or furosemide. Yeah, it looks like we need to bump up his potassium. What dose is he on?
What dosage are you on for potassium?
100.
Also, 100. Also, the doctor has him on Lyrica.
Lyrica? Okay. Yeah, and that's for that tingling, that's neuropathy is what that's called.
Okay.
Yeah, but let's we'll probably have to look at his potassium levels again next time he goes to the doctor, because I think it's still bothering him, and he's probably just not getting what he needs. And maybe add on some magnesium too. That may help as well.
What's the dosage on that potassium?
The
How
potassium,
high can he go?
I think that well, it's really however you get to the concentration that you need. I think he's more like on 10 milliequivalents. Is it a little yellow tablet? Okay, yeah, that's 10 milliequivalents. How many times is he taking that a day?
How many times he take it a day?
Which one, Jay?
The potassium?
1 a day.
1 a day.
Yeah, and so we can either double that dose to where he's getting it twice a day. Does this particularly bother him at night? Or is it all throughout the day?
Well, it's like in the mornings he has leg cramp. You know, if he lays in the bed very long, then his legs start hurting.
Okay, yeah, so it sounds like he may need a twice a day dose. So I'm sure it stops after he takes his potassium tablet. That, or we can increase his dose to a 20 milliequivalent. So I would make sure you let the doctor know next time, and just let him know the pharmacist suggested that he probably increase his dose or how many times a day he takes it. So when he takes that evening dose, he'll have some protection for when he wakes up in the morning.
Okay, well, thank you. That answers my question.
Yes, ma'am. You're welcome.
I really like your program, and thank you so much.
Well, thank you for watching. I appreciate your call.
Bye-bye.
All righty, bye-bye. Okay. Lucy, welcome to Pharmacist on Call. How may we help you?
Hey, Dr. Pruitt. This is Lucy. How you doing?
Pretty good. How are you?
I'm fine, thank you. I've got a question, but
Yes,
I want to thank you for doing a shout-out to the fans of Nipsey Hussle.
Yes, ma'am.
Nipsey Hussle not only changed the channel, but he adjusted the volume, and I hope people who really do admire what he was doing keep it cool and pick it up and times it times 10, because I have a lot of respect for Nipsey Hussle. I knew a young man who knew him when he was young. They're the same age. But anyway, I got a question about diabetes medication. I saw you on TV with talking about how they were going, Cigna, I think it was going to adjust the price down. Can you give those of us who aren't on diabetes medication, but probably will be soon at the rate some of us are going, can you give us an idea basically what most diabetics, what they require a month and how much they're spending and how much it was, say, a few years ago, how much it's gone up, so we can get a good idea of how much these people are being taken advantage of? Could you?
Yeah, so the insulins in and of themselves are fairly expensive just to buy, and so the insurance company picks up the bulk of that cost. So your cost, which is your insurance copay, I've seen it range anywhere from $45 for 1 month on up to like, gee, I think the last lady I had, this was last week, hers was like 135. But that might have been like for a 2 or 3 month supply. So those copays on those insulins can range very high, and it's simply because it's a branded medication, it's expensive, and I promise your insurance company really just does not want to spend that kind of cash on it. So what it appears is that Cigna has negotiated some sort of price reduction with the manufacturer that they're able to pass on to the consumer.
Okay.
Now, as I mentioned in my spiel there, is that is great. However, you know, my concern always being the uninsured Middle Tennesseans.
Yeah.
Where is the relief going to come from for them? And so it remains to be seen. I remember the president saying that he was going to do something about the price of medication. So we're going to see what happens on that front.
Okay, Dr. Pruitt, if you're uninsured, then what is it running a diabetic for medication if the copay is that for people who are insured? And I'll take the rest of your comment off the line, okay?
Yes, ma'am. All right, thank you, Lucy. So it depends on what the piece is, and so some of my patients who have to pay out of pocket, it's going to be over $100. You know, and I discount as much as I possibly can. And for those of you who are on like pens, some people have to buy like a 1 or 2 pens at a time just because of the cost. So yes, these people, especially uninsured, are spending a lot of money on insulin just to stay alive. And so that's why we are here. We're here to recommend alternatives to help you get your blood sugar down, and lifestyle modifications to help you get your blood sugar down to decrease your dependence on insulin. So there's my spiel there, but hopefully the President's a man of his word, and he will look into getting the manufacturers to lower the cost of drugs like insulin. Okay. Wanda, welcome to Pharmacist on Call. How may we help you?
Hi, how are you tonight?
Pretty good. How are you?
I'm well, thanks for asking. I was calling you in reference to the cramps. I noticed a caller called in earlier about cramps in the legs.
Yes.
I too experienced those, and I've been in and out of the hospital for cramping. At one point I was told it was rhabdo, but rhabdo doesn't last as long as it has lasted with me. So I'm wondering what I could take for leg cramps. And these are major cramps in my leg.
Were you on cholesterol medicine?
Never.
Okay.
I don't take any medication, never have taken any medication. I did have blood clots back in 2010 in one of my legs.
So that could be a
health condition.
Yeah, what we call a DVT. So I would get that.
Yes, I had a DVT and a PE.
Okay, yeah. So that, but so where's the cramp taking place in the back part, like where your calf and all that is, the back of your knee?
Yes, yeah. Is it in my feet? Like I get major cramps in my legs and in my feet. Like you could see the muscles actually jumping in my legs.
Well then, you too, I would recommend potassium for. And if you're not a big fan of the tablets, you can get it naturally from bananas, maybe some green leafies like spinach, and then of course orange juice.
But the thing is, I've gone into the doctor, several doctors, and they've checked all of that.
And said your potassium was normal even though you're spasming?
Yeah, everything is normal.
Okay. Well, then I would certainly, since you're telling me that it's also, you know, in the back of the knees and the thighs again, to have them check you for a DVT again. Yeah,
Okay.
but that is truly strange.
And then what do you
ask them about your magnesium levels too.
Okay. And then what do you recommend for ADHD for parents who are against medication?
For parents who are against medication, you can do a couple of things. GABA, which you hear me talk about for sleep in many shows. GABA has been researched and shown to be effective in children with ADHD because it decreases that dopamine because they have increased levels of dopamine in their brain. And of course, CBD, hemp oil, will also reduce the effects of ADHD secondary to that high, that low serotonin, but that high amount of dopamine. So those two seem to be fairly effective in helping children with ADHD. And then certainly modifying the diet, making sure we're decreasing as much processed sugar as we can and sugar alternatives.
Okay, and so the CBD is not habit forming?
No, ma'am, it's non-habit forming. So I know some people are concerned that it's a gateway drug, but it's not. It does not have the effect on the body that opiates do. In fact, it helps people come off of opiates. So you can take the hemp oil, never take it again, and you won't get the sickness and the craving and all of that. So no, it is perfectly fine for him to take.
Well, I appreciate you. Thanks for answering my question.
Yes, ma'am. That was a great call, by the way. Thank you.
Thank you.
All righty. Yes, ma'am.
Thank you.
All right. May, welcome to Pharmacist on Call. How may we help you?
Hello?
May?
Uh-huh.
How you doing?
Doing fine. Thank you for taking my call. I was just wanting to know about this juice, what you have on now. I live in Murfreesboro. Where else can you get it? You have to get it at your pharmacy in Nashville?
Yes, ma'am. I mean, we can ship to you, but gee, you're just 30 minutes away. I'm not sure if any other stores are selling it, but yeah. Yeah, the beetroot juice is what we recommend for blood pressure, diabetes, and it works quick. It does its thing.
Yeah, and I need some. I need some of that. Is it real expensive?
$17.99, and this should last you about a week and a half, maybe 2 weeks, because you're just going to take a capful. You're going to do it first thing in the morning before you eat or drink anything. Your blood pressure is going to be lowered somewhere in between 45 minutes to an hour. Your A1C and your blood sugar will be low, depending on what level you're at.
Well, I surely need it. So
yes, ma'am.
And I do watch you. I really, really enjoy all the good answers.
Okay.
I've learned a lot, because I've learned when I watched before, you was talking about the alkaline water. See, I don't drink nothing else now but alkaline water. It is superb.
Good.
And I thank you.
Yes, ma'am.
Thank you for taking my call.
All right. Thank you for watching. And also, caller, we're open on Sundays. So if the week is Sunday 12 to 4 for those of you who live out of town. I know we've got West Tennessee and Kentucky watching. So at 12 to 4 on Sunday.
I go to church sometime in Nashville, so that'd be a good time to come over there.
Yes, ma'am.
Thank you.
All right. Thank you. Okay, we got one more caller. Welcome to Pharmacist on Call. How may we help you? Hello?
Hello?
Yes, ma'am.
Hello?
Hey, how may I help you?
Yes, I was trying to, I was wondering, I had muscle spasms. I had cramping in my legs at night.
Mm-hmm.
Because I felt it broke my back in both places, one thing. And, but then when I go to bed at night, I have cramps in my feet and legs.
Okay.
You know. But the doctor put me on a muscle but it seemed like it just ain't helping my back. You know, my back is in bad shape. I'm almost trying to learn how to walk again, you know.
Yes, ma'am.
And I'm wondering what I can get for muscle spasms, you know. Because I have them real bad at night.
So if you want to go natural, so I'm sure that they've tried you on either cyclobenzaprine or Soma or tizanidine. If you want to go a natural route for muscle spasms, like I've told the previous callers, look at magnesium and look at potassium. Are you on blood pressure medication?
Yeah, I think blood pressure pills. I don't know, because my daughter uses my medicine. I don't know what kind of blood pressure pills they are, but I know they little bitty pills.
Pink pills?
Yes.
Okay, so that is the source of your problem right there. The hydrochlorothiazide is making you pee all of your potassium out, and so we need to put more potassium back in your body to stop that cramping. So if you talk to your daughter next time, have her to ask your doctor about your potassium, and just tell her to let the doctor know that you've been cramping and you probably need potassium. Or, ma'am, if you just got some bananas at home, knock you about 1 or 2 of those out, or a nice glass of orange juice, and you should notice the cramping stop.
Okay, I'll do that then.
Yes, ma'am. All right, you're welcome.
Bye-bye.
All right, bye-bye. All right, everyone, we are up on our first break. Stay right there. We'll be right back.
This is a Storm 5 weather update. For weather on the go, download the Storm Shield app.
Rain continues its march across the mid-state and into our Kentucky counties. Widespread, we'll have area showers across the area tonight, but we won't look at an opportunity for too many thunderstorms. A few rumbles of thunder are possible, but they'll mainly be located along our southern border, so closer to Alabama. As we head towards daybreak Friday morning, conditions will improve quickly. Drying skies by lunchtime on Friday, and temperatures stay mild, even despite the rain being around. 56 is what you wake up to Friday morning. Low 70s is where you end the day. Here's a look at where temperatures sit right now across the southeast, and of course current conditions right here in Nashville. Tonight that rain will become more widespread. Temperatures will stay steady in the mid-50s during the overnight hours, and then as a few rays of sunshine try to poke through Friday afternoon, that'll help get us into the low 70s. Near 80 both Saturday and Sunday. Saturday the driest day of your weekend, with storms returning Sunday.
moments you share with your best friend. The greatest could be the moment you save her life. Every second counts in cardiac arrest. Learn hands-only CPR and be the difference for someone you love.
Recovery from mental and substance use disorders is real.
You can recover.
It's possible. It happens every day.
Never give up on yourself.
Discover hope and help.
I thought I was too far gone. I wasn't.
Join the Voices for Recovery.
The world is a beautiful place again.
For 24-hour free and confidential information and treatment referral for mental and substance use disorders for you or someone you know, call 1-800-662-HELP.
All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, your community pharmacist. We're going to get right back into your calls right now. So looks like we've got Michelle. Welcome to Pharmacist on Call. How may we help you? Hello, Michelle?
Yes.
Yes, ma'am. Ask away. Pretty good. How are you?
I'm good. I was calling because just about like everybody's talking about the leg cramps and all that.
Yes, everybody is.
And that's what made me start calling. That's what made me call. My leg is like in the front of, well, my thigh, it's tingling and numbness. You know how when you your leg go to sleep?
Yes, ma'am. It's called neuropathy. Mm-hmm.
Yes. So mine has been doing that for over a month now. I went to the ER twice within 1 week, and they gave me a shot. It kind of eased the pain, but the numbness is still there. I have the degenerative disc. So
okay.
I'm just trying to figure out for what I can do to, to stop the numbness.
Okay, so yeah, that's what I figured, neuropathy, and it had something to do with your back. And this is an instance where the hemp oil will help you, probably just the CBD, the non-THC form. What it does is it slows down that transmission of that nerve sensation, but it also helps with the pain from the degenerative joint disease in your back.
Okay.
Yeah, so I think that'd probably be a good option for you if you're trying to not be on opioids per se.
Okay, so I mean, what did you say that I need to
The hemp oil.
to do?
Hemp oil.
I didn't hear you.
H-E-M-P.
Hemp?
Hemp, yes.
Okay.
Mm-hmm.
Okay.
Yeah, so yeah, and like I said, the non-THC version, THC-free, and it's a full spectrum, so it has all the components of cannabis, each one with a different health benefit. So give us a call at the store tomorrow.
Your store?
Yes, ma'am. So make sure you watch till the end of the show. The producer will flash our information, and then you can just give me a buzz tomorrow.
Oh, okay. I will.
Yes, ma'am.
All right. Thank you.
Okay, thank you.
Okay, thank you.
All righty.
All right, bye-bye.
Linda, welcome to Pharmacist on Call. How may we help you? Hello, Linda?
Yes.
How you doing?
Oh, I'm feeling a little bit better now that you assist me in my pain meds this morning.
Okay. Hey, how you doing?
I'm blessed. I'm laying here all tucked in and ready to go to sleep, and thumbing through the television and having to see your wonderful face.
Well, thank you.
So I wanted to call and thank you personally once again for helping me out.
Yes, ma'am. Yes, ma'am. You're welcome. And hey.
But I want to also ask you, I know I tried that oil, that cream that time.
Yes, ma'am.
But now, that numbness like the other lady and that tingling is still in my left thumb joint and my index finger, and it's very uncomfortable. And as well as my neck. I have a problem with that too as well. But from 1 month to the next, that picture $199 is going to put a damper on my pocket because I am on a fixed income.
Yes, ma'am.
What can I do about that? Is there anything I can do about it as far as getting some assistance on helping me with that pain medicine every month?
Yeah, and unfortunately, you're one of many people who are affected by the new opioid laws where they only pay for, I think it's like once every 6 months or something to that effect. But I think that this is something that your doctor can get done if they press enough. I mean, I think you would qualify being, under chronic pain management care. So I think it's just something the doctor really needs to push on.
Okay. So I just need to dig into talking with Dr. J. Stubblefield this month.
Yes,
when I
ma'am.
go back.
Yes, ma'am.
And see if he can give me some assistance.
Yes, ma'am.
Okay, then, Dr. Ford.
All right, Miss
Have a
Linda.
blessed night.
Yes, ma'am.
And I'll see you in the hood.
Okay, I'll see you in the hood too. All right, have a good one now. All right.
You too.
Yes, ma'am.
Bye-bye.
All right, bye-bye. So yeah, one of my patients at the new pharmacy over in Napier. So yeah, this the whole opioid piece is it is affecting a number of patients, and fortunately it's out of our hands. But if you're having trouble, then give us a call, and we can try to do as much as we can to talk to your doctor to get them to go ahead and get the prior authorization done. All right, so we have got Nancy. Welcome to Pharmacist on Call. How may we help you?
Yes. Okay, I am very confused about your water.
Yes, ma'am.
Okay, if I order like 6 or 7 gallon at one time, how long is that good? How long is the alkaline good in that water? What's the shelf date?
That's a good question.
You know what I'm saying?
Yes, ma'am. So I'm sure you and then a lot of other people have been told by, business or water company owners, hey, it's only good for 2 days, and after that you got to throw it out and come and get some more. Well, you know what? That's a good business ploy. And I'm sure none of them are healthcare professionals or a chemist like I am. And then just ethically, that is not true. We've had people, of course, vet us, and they've said that our water remains alkaline for up to 2 weeks. 6 gallons, you should be knocking out at least half. That should take you about 2 weeks to go through, and your water's still going to remain alkaline. And of course, like I tell everybody, once we filter out everything, the gunk doesn't jump back in the water. And so your water is still clean. It just may lose some of the antioxidants over time because of exposure to oxygen. Excuse me. So make sure once you uncap it, pour what you need, and then cap it right back up to hold on to your antioxidants. But the main thing, which is the alkalinity, that remains for a couple of weeks. Very good question.
Do you deliver to Murfreesboro?
No, ma'am. We go as far as Antioch. So yeah, we have that Murfreesboro area. We are looking at. Just depends on how
But you can ship it.
Certainly, or ma'am, I tell you what, if you just meet us in Antioch, our delivery guy would meet you in Antioch somewhere.
Okay.
Yeah, and so we do that for some of the out of the city area people.
Oh. Okay. Okay, how much is it a gallon at your place?
$3.50 a gallon, and then $5 delivery charge.
Okay.
And then the refills are $2 a piece.
Right. Thank you for answering my questions. I appreciate it.
Yes,
Have a good
ma'am.
night.
Okay, you too. All right, thank you.
Bye-bye.
All righty. Betty, welcome to Pharmacist on Call. How may we help you?
Yes, this is Betty. I wanted to make a comment in regard to the leg cramp.
Yes, ma'am.
I have experienced the same thing. I did increase bananas, orange juice, and still had the leg cramps. And then I was advised to increase my amount of water per day. And as long as I drink plenty of water, I do not have the leg cramps. If I get low on my intake of water, I can be assured that I will be awakened with leg cramps during the night.
Betty, I appreciate that. You are on my show dropping knowledge. So yes, everyone, you do have to make sure you stay hydrated. And as we get into the warmer months, and of course we've just left the cold season, we've all slacked up on our water drinking. And yes, that is gonna, the dehydration is gonna cause some cramping as well. We appreciate that, Betty.
And I want to tell you one other thing.
Yes, ma'am.
The dog I told you about that we gave the CBD oil, that was 6 months ago. And that dog laddie is still going full force. His legs are working good from his arthritis being treated with the CBD oil.
And for those of you who don't know, this dog was getting ready to be put down. I was wondering about how long ago that was. And
it It was 1st of October.
Yeah, and she brought some hemp oil over, the pet hemp oil over to her friend, and I think you said, what, 10 minutes the dog was up walking around?
Yes.
Okay,
yes.
After laying around? Yeah.
And the vet already had it scheduled to put the dog down that day.
Okay.
And that dog's life has been spared. He's had an extra 6 months of happy living.
All right, so you pet parents out there, don't let your pet suffer in pain. Come get you some pet hemp oil at Pruitt's Discount Pharmacy, and that'll bring your pet back to life. We appreciate that call, Betty.
Absolutely. Thank you, and thank you for taking my call. I love your program.
Yes, ma'am. Thank you for watching.
Bye-bye.
All righty, bye-bye. All right, everyone, we're opening another break. Stay right there. The phone lights, they're lighting up.
Creekside at Three Rivers, our senior residents are treated like family. Creekside at Three Rivers features 24-hour on-site nursing, Fox Rehabilitation Services, and an updated dining experience. Visit us online and see if Creekside at Three Rivers is what you've been looking for.
Whether a house is new or whether a house is 20 years old, we can go in and we can find debris in the lines. Mr. B's is about doing duct cleaning the best that we can do it, and better than anybody else in the industry. And we literally cut a hole into the main trunk line, and we attach a HEPA vacuum system to it.
All right.
When we do that and turn it on, it causes a negative airflow. As that machine's sucking everything backwards, we go to each line and we'll brush it, and then we air sweep it down to the trunk line. Everything is being brushed and air swept to the trunk line, not bringing it back into your breathing atmosphere. What makes my home need an air duct cleaning? You have to make that decision. It's your environment. And so if you have black lines at the edge of your carpets, or you have any sort of dust, excess dust in your home that you're dealing with, and that's a problem for you, then you definitely would want your air ducts cleaned. And as I've said before, people can outprice me, but they're not going to outclean me. There's only one way, and that's the right way, and that's what we do at Mr. B's Air Duct Cleaning.
Here at Pruitt's Discount Pharmacy, we want to be a part of your healthcare family. I'm Dr. Sean Pruitt, and let me show you what I mean. We accept every major insurance, but if you're uninsured, we understand. At Pruitt's Discount Pharmacy, we offer lower prices for you so you can afford the medicines that you need. And you don't even have to live nearby. We offer citywide free delivery from Hendersonville to Antioch. Get to know us at Pruitt's Discount Pharmacy. Join our family and
feel good.
That's Pruitt's Discount Pharmacy, the pharmacy choice for the uninsured.
Creekside Villas offers the best in luxury living with premium amenities located in a tranquil setting. Creekside Villas are a part of our innovative memory care program and provide tailored quality care. To learn more about Creekside Villas, call today or visit us online.
All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, your community pharmacist. We're going to get right back into your calls, and we're going to go with AJ. Welcome to Pharmacist on Call. May we help you?
Hey, how's it going, man?
Pretty good. How are you?
I'm doing great. First of all, I want to thank you because a couple summers ago I had an issue where I had a ulcer in the bottom of my foot. I couldn't heal it, but I did know about Kangen water for very many years. And I remember that if you get the acid water and you soak your foot in it, the acid water is, well, hell, we're made of water. So, you know, it can't hurt you, but it will kill the pathogens and stuff. And I still have my foot, so thanks for that.
Okay, yeah.
I was one of the first people that I could ever get a hold to that water. So, and I want people to know that it has so many different uses. They need to understand what it's for, and they need to understand that water is what we are, and carbon.
Yes, we are.
And stuff. So, but thank you for that. And I'll need to know I got CBD ultra oil.
Okay.
How do I start the dosage on that?
What's the milligram on it?
It's 100 milligrams.
100 milligrams. I would probably, what size bottle?
That's what I'm saying. Hold on, we'll get it. It is 100 milligram bottle.
So is it a small bottle or the 30 ml bottle?
It's the small bottle.
Then I would do about 5 to 10 drops up under your tongue. Let it sit there for a minute or so.
Okay.
Actually, just start out with 10. Let it sit up under your tongue, and from there it's going to go into your bloodstream rather quickly. And then you just swallow the rest. You should feel the magic happen, shortly.
Right on. Okay. All right. Thank you very much.
Yes, sir.
Keep doing what you do, man, because, pharma don't care about us.
No, but I do.
Amen.
Yes, sir. All right, thank you, and I appreciate that. AJ brings up a very good point. The water has a multiplicity of uses. So the acidic water, great for bacteria and pathogens. The super alkaline water for soaking your vegetables. Beauty water for skin and hair. But we're going to jump into some of these other calls here. Ava, welcome to Pharmacist on Call. How may we help you? Hello, Ava. Going once, going twice.
Hello.
How may I help you?
Yes, I was calling to see what would you recommend supplement for a senior parent that's been diagnosed with stage 3 kidney disease?
Stage 3 kidney disease. I say start them on the alkaline water, which is going to replace whatever they're drinking now.
She's just drinking just regular water.
Okay, let's get her on alkaline water so we can, tax her kidneys less. And then the other thing is burdock root seems to work really well in my patients with kidney disease.
Okay. Now, does the alkaline, because it seemed like I read that alkaline, I guess because, she has to now monitor her phosphorus intake and potassium intake. Does the alkaline, would that, kind of further damage her kidneys, or because right now we're just trying to, maintain it and strengthen them if we can?
No, ma'am. No extra potassium.
Okay. Okay. What about phosphorus?
Phosphorus. I can't think of any phosphates being present in there.
Okay.
Yeah, it's water.
Okay.
H2O. Yeah,
I'm sorry?
It's H2O. Yeah, there's no phosphorus compounds in there. But you want the cleanest water you can, because part of the kidney's function is to filter all the gunk out. So the cleaner the water is, the less work her kidney has to do.
Okay. Okay, so you recommend alkaline water, right? And you guys make your own?
We do, yes ma'am. We have 2 machines and about to get a 3rd one where we process the water. But burdock root also, and she can get it in tea form if she likes tea, or capsules.
Tea form or capsules, okay. All right, and do you guys carry the burdock root as well?
Yes ma'am. Yeah, I just got a shipment in 2 days ago.
Okay. And one more question, Dr. Pruitt. What do you recommend as far as strengthening, I guess, the brain in terms of like, cognitive impairment?
There is a product, and I haven't really vetted it. Prevagen, I believe, is what it is. But I've had one patient try it, and she swears by it. But I usually recommend ginkgo biloba, because what it does, it increases the blood flow in the brain.
Okay.
So I recommend ginkgo biloba. But Prevagen.
But does the ginkgo, it doesn't increase blood pressure, does it?
No, ma'am. Actually, it would decrease the blood pressure because as you open up the vessels, that's less pressure the body exerts against that.
Okay. Okay. So ginkgo. Okay. All right.
Ginkgo biloba.
Ginkgo biloba. Okay. Great. Thank you so much.
Yes, ma'am. You're welcome.
Bye.
All righty. Bye bye. Let's see. Thelma, welcome to Pharmacist on Call. How may we help you?
Hello.
How you doing?
Hello, Dr. Pruitt. This is Thelma, as you know.
Yes, ma'am. How you doing?
Well, pretty good. Really enjoying all this great information that your public is sharing with you. I wanted to ask you about turmeric, and if there's any possibility of like taking too much of it. Is it better to take the capsules or is there any...
Or the powder form?
If you could take it loose, yeah.
I think either way is fine. I prefer the capsules because that way I know what dose I'm getting. So when you're trying to sprinkle it over your food with a spoon, the dosing can be inconsistent. You may be giving yourself too much, or you may be giving yourself too little. Can you OD? Can you take too much? Yeah, I would imagine like anything else, you probably could, but it may be a little tough to do. I know
not with the 800 milligram capsules, if you just take 1 or 2 of those a day.
Yeah, and I've taken up to 3 if I'm getting ready to work out, just because I really want to be, no inflammation while I'm working out. So yeah, I would say 1, 2, 3 is fine.
Okay. Okay, and that's before you do any exertions.
Yeah, and then sometimes I take it before I lay down because, you know, depending on how you sleep, you may sleep funny and your back is hurting when you wake up. So I just prefer to also take it. I take it twice a day.
Like a Charlotte horse in the neck, and that would help if you sleep funny. Okay. Well, I appreciate that very much. And also, could you tell me what are you talking about? Are you on again on Sundays?
No. So I'm going to do another show 2 weeks from today because I did not do a March show.
I see.
So I got to make it up to the viewers. So, yeah. So we're going to do 2 for the month of April.
Okay, 2 for April. Well, that wouldn't be Easter Sunday, would it?
No, that would be Thursday.
That Thursday before Easter Sunday.
I'm not even sure when Easter is, but yeah, it's the 18th.
I'm looking at it. It's the 21st.
Okay, so then yeah, that would be Good Thursday.
The 18th. Okay.
Yes, ma'am.
All right. Well, let me get back to enjoying the show. Thank you for the information, and I've got the 800 milligram capsules, so I'll just keep those.
Yes, ma'am.
And not try the loose form yet.
Yeah. Just 1 or 2 a day should do you.
All right. Well, and also that cream, the CBD cream.
Yes, ma'am.
Does that act in any way to like push heavy metals or anything out of the body, or is it just for pain control?
Well, no, it's just for any type of skin irritation. So a lot of people use it also for eczema or different types of rashes or skin infections. So I don't think it may. But as far as what I know, no, it doesn't push any toxins or heavy metals out, not to my knowledge.
And how much is the cream, Dr. Pruitt?
The cream, and I didn't even bring it, it's $39.99. It's a tube about that size.
What's that in that pink box?
This?
The pink box, what is that?
This?
Yeah, the tall pink box.
This is a petamine. This is a weight gaining supplement. So for those, people who want to pick up weight, get thick. Yeah.
Well, okay, my granddaughter Chelsea may want that, but no, I was thinking that pink was the cream.
Yes,
okay, it's $39.95 for the cream, and you just want about a 30-day supply, or
probably about 2 weeks, depending on how you take it. Yeah.
Depending on how often you use it. All right. Well, thank you much, Dr. Pruitt, and you have a great rest of the night. I'm going to enjoy the show.
Okay. All right. Thank you.
All right. Bye-bye.
All right. Bye-bye. Now, for those who don't know, that's my mother, a frequent caller into the show. All right. So we've got Eugene. Welcome to Pharmacist on Call. May we help you? Hello, Eugene. Eugene. Turn your TV down there, brother.
Yeah, hey, I got a question to ask you. I had a physical about like a week. Pardon?
Go ahead.
Yeah, I had a physical about like a week ago. Everything checked out all right, but he said my cholesterol was a little high to kind of watch my diet. I just wonder, is it something that I should, because I don't eat right no way, but is it something that I just can take like once a day, for my cholesterol?
Absolutely. There are a couple of things, 3 things you can take. The first is red yeast rice. And what it does, it actually acts like a cholesterol medication. The liver converts it into, I believe, Mevacor, which is lovastatin. The second thing you can use is the beetroot juice here. This also reduces your cholesterol too, and man, high in fiber, so will help clean all that stuff out. And then the third thing that you could use is Garcinia cambogia, which is our weight loss supplement. This also blocks the body from making fat at night, and so it also decreases your cholesterol. But to you, I would say probably just modifying your diet would